exercise and weight management into a lifestyle issue that would be helpful.
Mm-hmm. Yeah, that's another area of research within our department, looking at the whole area of exercise for children with congenital heart disease. It's very understandable that parents will be anxious about exercise sometimes for the child who's been treated for a heart problem. What we have found in our own work, and other researchers across the world also find, that for children with congenital heart disease, to have exercise is very important for their well-being for the future. One of the studies that we did was to look at an exercise program for children with congenital heart disease, and what is important is that that program of exercise, or the advice around exercise, is appropriate for that child's condition. There are some children that we treat who have no limitation on what they can do. They can be in competitive sport, but for children that perhaps at the other end of the scale, it's not appropriate for them to be involved in competitive sporting activity. But we do want those children to participate in other forms of exercise that benefit their overall health, and also help their heart condition in the long term. So when we see patients for review in our clinics, one of the issues that always comes up is what is appropriate in terms of exercise, and we try and advise as best we can. And indeed, in one of the research projects, we give written individual advice to the parents about that. And the unit for the Children's Heart Unit in Bristol now has an exercise prescription sheet, which we've been trying to adopt as well. And I think that is a very useful thing. In terms of weight management, I have to say, in my experience, that that hasn't really been an issue with children with congenital heart disease. It may be, I suppose, as some people reach adulthood, and across the world, obviously, obesity is an increasing issue. But I think our parents of the children are probably so motivated in terms of keeping their children healthy, that in practice it thankfully isn't a huge issue for us. The exercise issue is an issue, but one that we manage just individually, and we want, for these children, our goal overall in caring for them is to make those children and as closely integrated into normal school life, normal life outside of school, and ultimately into employment and their own families as possible. So what I have seen during my time in pediatric cardiology is that, going back 10, 20 years ago, our big focus was on survival and getting those patients through the operation. And now we have very, very good results. Sadly, not every child can come through surgery, but our focus now is on the complete care of the patient to when they come through their surgery, to make sure that whenever they go into school, that we can identify any developmental issues, educational issues that are there, so we achieve the best possible outcome for them as a person, as they come out into the big bad world in society. So these issues are around all of that are very central to our care now.
Thank you very much.